Welcome to Scoop and Scale, where we dish up the science and weigh the facts about mostly equine nutrition. I'm Jill Jackson, lifelong equestrian, podcast producer, and pony owner. I'm a dressage rider and at-home horse keeper, living the challenge of managing easy keepers on multiple acres of pasture.
And I'm equine nutrition consultant, Dr. Claire Tunis of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and pony club mom.
Claire and I have been horse friends for almost 20 years, and like all good horse friends, we're always talking horses. We talk about the challenges of managing our horses, our riding struggles, feeding horses, and what's going on in the wider equine community. This podcast is a place for us to have conversations mostly about equine nutrition. It's for anyone who wants to make better choices when it comes to feeding their horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. And while I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
With that, thank you for joining us, and we hope you enjoy the following episode.
So it's early fall here, and as evidenced by the leaf blower outside my window and the combine outside of Jill's. And as we said in other episodes, early fall is a great time to take a moment to assess your horse's current condition. If it's underweight, put steps in place to try to reach a more ideal body condition before the depths of winter takes its toll. Now's the time to do that. It's also a great time to reflect on whether your horse tends to lose weight in the winter months and to make a plan for how you're going to try and avoid this issue over the next few months and this winter. Fall is also a time of year that many of us have our veterinarians out to do fall vaccinations, and it's a great time to have them check your horse's dental status, even if they had their routine dental care back in the spring. There can be many reasons why horses lose weight or struggle to maintain their weight, especially in the winter. Senior horses, in particular, face challenges with their weight, and young horses can also struggle in the winter as they can find it hard to regulate body temperature. Many things can result in weight loss, but today we're going to talk about dental health. I'm excited that we're going to be joined today by Yun Lai. Welcome to Scoop and Scale.
Hi, everyone. Thank you for having me.
So you have a somewhat unique background because in addition to having a master's degree in equine nutrition, you also went to the Academy of Equine Dentistry in Idaho and are certified with the International Association of Equine Dentistry. Could you tell us a little bit about the program in Idaho and what your master's research was on?
Sure, that's no problem. So the school I went to, it's called the Academy of Equine Dentistry. It is located in a little town called Glens Ferry in southern Idaho. It is kind of like a trade school, similar to some farrier school settings. It took me about 1.5 years to finish all the courses and case studies and internship to graduate and become certified. So to graduate from this academy, there are 5 courses to attend, and each level of courses has wet labs and theory classes, and you must pass an exam to pass each level. And the internships are required in between, such as like how many horses you have to work with a certified individual. And I have been certified with the IED since 2021. And about IED, it's International Association of Equine Dentistry. It is a third-party nonprofit organization providing education and certification tests for equine dentistry law standards. And they are members from more than 30 countries.
So that's a lot of education that you have to get then. I mean, that's like a solid 1.5 years just doing dentistry, as opposed to like a course on dentistry as part of another degree.
Yeah, it's a very intense curriculum, even though each level, like the actual in the academy time, it's 2 weeks or 3 weeks every time. But the time you have to spend outside of the class to get your requirements and get your skills up to speed and have enough cases under your belt, those takes a lot of time.
And then you did your master's degree?
Yes, so after that, I moved to Alpine, Texas, go to a small school called Sul Ross State University. That's where I get my master's in equine nutrition. And my research was on how dentistry impact nutrition parameters. We look at like fiber fermentation, digestion, and some fecal particle size and the fecal microbiome of the horses before and after dental work.
That sounds interesting. We'll have to talk about that a little bit later.
Yes.
We recently did an episode on finding a qualified equine nutritionist, and equine dentistry is another area where horse owners have a range of options available to them when it comes to selecting a professional. Could you share with us some of the differences between an equine dentist and a vet, and then what they are and are not allowed to do when it comes to working on a horse?
Yeah, so by law, the term dentist is reserved for board certified veterinary dental professional. So the so-called lay dentist, or usually what we commonly say equine dentist, is actually an equine dental provider or equine dental technician. And the abbreviation is EDP or EDT. And those are for people without a veterinary degree that just went to dental school and got certified or licensed in their states. And some states allow EDPs to do certain things, but it really varies by states in the US.
That's tricky then, because if it's different by state, as a horse owner, you kind of have to be aware, right, of what a practitioner can and can't do for you. And it can be tricky, right? Because somebody might be putting themselves out there to do something that actually they're not supposed to be doing in your state. So it certainly pays to be aware as the horse owner of what your state allows, right?
Yes, it is very important. And the dental law can be looked up online, or you can contact the IAED and they will give you the most updated version or any new updates about the law being processed, things like that. And some states don't even have licensing system for EDPs. But the states that have it is like Texas, Oklahoma, and Kentucky is one of the new ones. But some states only allow vets to do dentistry, such as Oregon and Washington. And some even require different levels of supervision, like general or direct supervision from a vet, such as California. And there are states that totally exempt equine dentistry from the veterinary law, like New York. So, but in general, EDPs cannot perform procedures that's veterinary levels, such as sedation, dental radiograph, and advanced extractions or maxillofacial surgeries. And some minor stuff like pulling wool teeth, pulling calves, which is baby teeth, it depends on each state. Some states are okay with that.
Okay. And so it sounds like you would need to have a good relationship between like your EDP potentially and your veterinarian in more complex cases.
Yes, for sure. Cooperation is always a big thing. To me, I work with vets, doesn't matter which state I work in, or even if it's back home in Taiwan, I always work with a vet. Partially it's because sedation must be given by a vet. A lot of people doesn't know that. So this is something that's just law strictly has it and you have to follow. And for advanced cases, the EDPs can see what's abnormal in the mouth in the beginning and have some suspicion and give it to the vet. And the vet have diagnostics and imagery and or endoscopy, things like that. I can run advanced diagnostics. They can know what's the problem or even refer to like a CT scan, things like that. And then you guys can work together to get the teeth pulled or get the horse having advanced check. So I would say it's always a cooperation and dentists or dental techs are like the front line first to screen out the simple cases and send the harder ones to the vet.
Mm-hmm. So I really wanted to do this episode because I think that a lot of people forget to consider dental health when they're struggling with weight loss in their horse, especially if their horse was treated by an equine dental professional or vet within the last 12 months. And we'll get talking about why it might still be related to dentistry, even if your horse saw a dental professional fairly recently. But I think it would be good to start with an overview of equine teeth, because that's kind of really interesting to me. And why horses, hopefully it'll be interesting to everybody else too, and why horses have the kinds of teeth they have, because they aren't the same as our teeth. There's some really cool things about equine teeth. So let's start at the beginning. So like 50 million years ago, right? The horse was the size of a dog and living in
Hold on.
forests.
Everybody's get your coffee and sit down. We're going to start 50 million years ago. This episode's going to be like 7 hours long. You make it sound like we're going to be here forever.
Well, I thought you were going to chime in because I thought you were going to get like, sassy and be all like, well, it depends on the size of your dog, because Jill has Great Danes. So they're like actually they're the size of a modern day pony. Meanwhile, I used to have a little terrier thing. So, but anyway, the point being, they were much smaller than they are now, and they were browsing greenery. But subsequently, they moved onto the steppes and plains where they're a lot more like high silica grasses. And so their teeth, as I understand it, they evolve with that diet change. So could you share with us how horses' teeth, maybe not taking 50 million years, have evolved to what we see today?
Yeah, I will try to squeeze that in. So so it is just like Dr. Claire says, there's a high correlation between tooth shape and the type of diet. And when the 50 millions ago, it is the Eocene period, and they have typical bunodont teeth, which is like human, like primates. That's what we have. The characteristic is like we have a superficial cusp and very subtle and irregular margin and a really short crown. And the molars for the horses in Eocene period were triangular, and incisors were resemble like fangs. And those horses were fed on leaves and buds.
Hmm.
Yeah, and there are like different ancestors in one period, but when we move on to the Miocene period, which is the colder period, that's when the more molar teeth were more developed, but still had a short crown with an infundibulum filled with the cementum, and they are just different dental materials. And the more modern incisors have a flatter occlusal surface, which is like a flatter top, and the cusp in the middle of the incisor.
Yeah, so some people might have seen that, right? Like if you ever do, and I think we'll maybe talk about this a little later, but like if you look at teeth to try and figure out how old your horse is, and you look at the incisors and you look at the flat surface of them, you notice they have like different colors and different shapes and things. And so that's obviously changed. That changes as the horse ages, but it sounds like that's changed over the evolution of the horse as well, like over many, many thousands and millions of years as well.
Yes. So the main thing are like the occlusal surface has more ridges and like stronger dental materials like enamel, so they can grind up the silicone silica in the forage. So those are like the main thing, and also the crown develop in height, so they go from brunodont into hypsodont, which is have a long reserved crown under the gum line, and they were born with this set length. And also they have other dental materials called cementum that kind of fill all the empty spaces and strengthen the tooth so it can withstand like strong impact and grinding surfaces. And finally, these teeth are getting bigger and bigger. And this leads to them developing a bigger skull to house all their teeth. Otherwise, they will be out of space and the teeth will not be like aligned. So, yeah, that's how the evolutionary evidence showed us.
I had a quick question. She made a really interesting comment about the skull, something I've been super curious about, because you hear people say this, and I want to know if it's true. So mini horses often have problems with their teeth, and I've heard it's because their teeth are the same size as like every other horse, but that their heads tend to be smaller, and so they're trying to jam a lot of same size teeth into a smaller head. Is that actually true?
Yes, so that is true.
Ah.
Miniature teeth are really about the same size as a full like horse. The drap horse teeth, it looks like just a normal horse. The teeth doesn't really grow with the size of the horse, but the skull cavity, the itself, it does change with a different size horse. So it is harder for us to work on miniature horses because there are limited spaces. And when it comes to a drap horse, it is very spacey and you can do any hand movement in their mouth. It's just a lot easier to work with.
That makes
There's some
sense.
great images online showing the changes in the horse's molars and also limbs over the past 50 million years. And I'll put a link in the show notes that show that so that you guys can take a look at it. It's my understanding that horses have a finite amount of tooth and that their teeth keep erupting over time. Is that true?
Part of it is true. So horse teeth does have a set length with the dental germ develops into adult hardened teeth. The teeth you see in the mouth are called clinical crowns, and the teeth you cannot see that's under the gum line is called reserve crown. And on average, the reserve crown erupts 2 to 3 millimeters into the oral cavity every year. But for younger horses, such as those from 5 to 10 year old, they can erupt up to 4 to 5 millimeters a year. When they get older than 18 years old, the eruption slows down and teeth can reach a terminal stage, which is no reserve crown left, and it is called expired.
So I once had it explained to me that the horse teeth, and I think, and you'll correct me if I'm wrong, this is where the term hypsodont is this kind of continually erupting, right? Is that what a hypsodont tooth is? It's a tooth that kind of keeps erupting.
Yeah, so there is two terms that's very similar. One is hypsodont and one is hypsilodont. And the hypsilodont is the one that's on rabbits that just endless erupt and endless
Mm,
supply.
right.
Yeah, a hypsodont is like horses with a set length but erupt every year.
So it's a little bit like how somebody once explained it to me. I think it was a vet said it's a bit like having a pencil lead and a mechanical pencil, in that you have that finite piece of lead and you keep clicking the top of the mechanical pencil and the lead keeps coming out the bottom and you keep writing with it and then the lead disappears and you click it again and a bit more lead comes out. But eventually you keep clicking and there's no more lead left. Like there is actually a finite amount of tooth, unlike you're saying, like with a rabbit where it just keeps coming. So
Yeah.
I thought that was a really interesting visual for people that perhaps are struggling to grasp kind of what we're talking about.
So let's talk
Yes.
about how teeth change over time because while horse teeth are different to our teeth in that they keep erupting continuously, horses are like us in that they're born with baby teeth and then they lose them. So, how do a horse's teeth change over their lifetime?
Yeah, so the average horse lifespan now can be like 30 years old or like 25 at least. So when they start as a baby, they are born with 12 teeth, and these 12 are the premolars, so three teeth on each quadrant. And but they will have their first four incisors, the number ones, in a week. And in 6 to 8 weeks, the seconds erupt, which is called the intermediate incisors. And the corner incisors come in the latest at 6 to 8 months old. Canine teeth usually come in around 4 to 5 years old. Wolf teeth can erupt at 6 months or up to 2 years old. It kind of varies a little. And only incisors and premolars have deciduous teeth, which is baby teeth.
Yeah, I saw a post on Facebook recently where somebody had found a cap off of an incisor and they didn't know what it was. And they were freaking out and they'd posted on this Facebook group going, "Oh my golly, I found this in my horse's hay bin and I have no idea what it is and help, kind of thing." And everybody replied and said, "It's fine, don't worry, it's like whatever it was, 2 years old, it's a cap, don't panic."
Yeah,
So
the shedding, it's at like 2 years old, uh, 2.5 years old, 3.5, and 4.5 years old for incisors. And so it's pretty normal for you to find that in your stall or in your bucket that there's something shedding. If they are not shedding, that's called retained cap, and you will need to have your vet or dentist come out to take a look and remove it. The mature premolar erupt at 2, 2.5, and 3 years old. And the molars, remember there's no baby molars, erupt at age 1, 2, and 3. So before they turn 5, which is the adult age, they have 48 eruptions and 24 sheddings to do.
Wow.
It is a lot of changes. Therefore, we usually recommend that horses have their teeth checked at age 2 with a recheck interval of 6 months until they're over 8 years old.
Yeah, that makes sense. And and it also hopefully our listeners can kind of appreciate why it's fairly straightforward to age young horses by looking at their teeth, because there are these, very clear things that happen at set points in time. Whereas, it gets a little more tricky, once a horse turns like 5 or 6, it becomes much harder to really accurately tell how old a horse is by looking at its teeth, is my understanding. But it's much easier to do when they're younger.
Yeah, so for when they get older, you can look for other stuff. Like a lot of people might heard of Galvin's groove or heard of the corner hook, but these are all secondary aging indicators, which means they are not as accurate and can be impacted by other factors. So the most accurate way to look at the occlusal surface, which is the top of that teeth, and in incisors, the cup disappear around 6, and the mark disappear at 13, and the enamel ring disappear at 15. And they always go from the lower centrals all the way to the upper corner.
So lower centrals meaning like the lower center incisors. So the 2 incisors on the bottom in the middle.
Yes.
And then you move out from that.
Yeah, they start changing first, and then the one next to it, and then the corner one, and then go to the upper side with the centrals and intermediate and corner.
Cool. Nice. And what about smooth mouth? Because that's the term you hear sometimes relating to age.
Yeah. So age is the main factor in anatomical changes, but it's also correlated with level of dental care. And according to traditional beliefs, non-functioning teeth occur around age 18. But now we have more modern dentistry. We can preserve the dental materials longer. And the smooth mouth is usually saying when there's like no teeth left, and now the age can be pushed back way later about that. And then I've also seen horses with no dental care that have expired teeth at age 16. But I also seen 25-year-olds with complete set of teeth and excellent routine care for over like the past 15 years and just have really good teeth.
Nice. That's a good reason to have your dental work done regularly. Because
Yes.
we all want our horses to be living a long time, and we don't really often want to be feeding them the things they need to be fed when they have no teeth left. So feeding them gets a bit more complicated when they don't have any teeth left. So as you discussed, just like humans and many other animals, horses have incisors, canines, premolars, and molars. Can you share with us what the function is of each of these tooth? What do they actually do? What's their job?
Yeah, so for incisor, its main function is to prehend the grass, which means it's a fancy word for grabbing the grass blades or hay, and the tongue will kind of sweep the hay or grass that's ingested to the back for the premolars and molars to chew on. The premolars, besides the first premolar, which is wolf teeth, are evolutionary remnants and have no function. The other premolars are all molarized during the Miocene period. So the function is the same as the molars, which is grind down food during the power stroke, where they have the most powerful pressure on grinding the food. So that's the function of incisor, premolar, and molars. And for canines, it used to be for fighting the stallions in the wild. They might use that as a fighting or as a threat, but you don't usually see that in human management that much. So a lot of time canines doesn't really have that much function when it comes to chewing.
To break it down, the incisors are your front teeth. These are going to be your grass nippers, right? And
Yes.
then the Premolars are those big ones at the back that the vet has to open up and really get back so you can see them. You got to put the light in there. You're not going to see those by just opening your horse's mouth up, right?
Yes, that is
Okay.
correct.
I just want to make sure that everybody, so you can picture your horse's mouth.
The premolars are ahead of the molars. So the molars are the ones
Right.
at the way back, and the premolars are in front of the molars.
Right. And then the incisors are your front nippers. And your canines, you're saying they don't really use them anymore, but I'd like to argue that because I have a rotten pony that likes to stand on his hind feet and bite my horse's withers all the time with his. So
I think it's worth pointing out too that canines, you generally only find canines in male horses, and maybe we said that, but it's very unusual to find them in mares.
And the size is different too. The one in the males are usually more protruding and sometimes even touching the opposing side. And the ones in the mare are usually pretty small.
And I learned something that's potentially useless information, but I thought it was interesting recently.
Can't wait.
The canines are different. They're not hypsodont, and that they don't erupt. Is that true? Like the canine teeth are different from the other teeth in the mouth. Is that correct? Do you know?
No, canine is still hypsodont because it has a set length under, and they don't erupt as much, I believe.
Okay. So maybe it's just slower.
Yeah, but I definitely have seen like bird down canine grow back up. But I also know that if you get like a really bird down canine, like open pulp degree type of bird down, they are not going to recover.
Yeah. So I think that something else you said that was really important there, that we just need, like, horses grind their food. We say, oh, my horse is chewing, but it's not chewing like us. Like, we chew like up and down, like kind of up and down. Like, they are literally grinding their food, which is one of the reasons why their teeth have such a large surface area, because they're really grinding that material. It's a different mechanism than we use to break down our food.
Yeah, so horses chew as like a figure eight. So they will have like a open stroke, which is like gapping the molars and open up the mouth. And then they will set like a rotation down, and then the crossover of the two arcades of cheek teeth, that's the lateral excursion. And they will have a closing stroke, and then power stroke. That's when they bring it back and then use it again to grind the feed materials.
So I think it's only I think we often think it's only the teeth that matter, right? When it comes to processing feed, like we just pretty much everything you just discussed there was in relation to the teeth, but in fact there are other important considerations. For example, like the tongue plays an important role, and you mentioned that in regards to the incisors kind of nipping the food and the tongue, working it back in the mouth, and the shape of the mouth even. And if people have ever looked in their horse's mouth when it's been open and being worked on, they would have seen like ridges in the roof of the mouth that are also important, and obviously there's saliva as well. So what are the roles and importance of these other components of like the horse's mouth when it comes to processing and chewing food?
Yeah, so we can start with the tongue and the roof of the mouth, which is called a really cute word. I really like to pronounce it. It's called rugae. And they will form the food into boluses and like roll it backwards. And so they can get into like ball shape and be swallowed. And this movement is called exia flow. And saliva is an essential component to help with this exia flow because it has to moisturize it and make it be able to swallow as a soft bolus. So saliva also contain like sodium bicarbonate. It's used to buffer the food in the mouth, and if you secrete a lot of saliva, you can buffer the stomach. And saliva contains other minerals such as calcium and phosphorus, and they will calcify the plaque, which is like your bacteria biofilm mix on your teeth, and calcify that into tartar or calculus. It's a hardened harder dental like calcification on the outside of your teeth.
So horses in the wild never see a dentist. Why do domestic horses need to see a qualified dental professional as part of their routine care? I know this question comes up all the time on social media, and people really like to use this as my horse doesn't need their teeth done. They lived all these years without getting their teeth done. So why do we need to get them done when wild horses are out there living their lives?
So there are multiple hypotheses. Like the first one will be wild horses or feral horses. They live by natural selection. So if they have bad teeth, they just die. So they are not able to breed more offspring if they have bad teeth. So that's why what we have seen nowadays, the wild Mustangs, when they get caught, they usually have pretty decent teeth. And also, wild animals doesn't live as long as the captive animals. So, because they don't have human care, they don't have routine health care, and it's just more risky staying outside, being eaten by a predator, things like that. So, um, these two reasons, so the genetics that pass down usually give them a stronger teeth. And also with the feeding management, wild horses, they ingest only abrasive grass materials, no grains or apples, bananas, no sugary feeds. So their teeth wear down more evenly. That's why feral horses, you don't see them needing dentists that much. And so why do domesticated horses under human care needs dentals? Um, it kind of answers itself because human care is not what they experience in the wild. And there's a study shows that stable horses have more dental abnormalities than those that kept on pastures. And also riding affects how horses move, such as the impact on the temporomandibular joint. And the temporomandibular joint is directly correlated with incisor angles and like the wear of the molar, things like that. So riding can also potentially cause the teeth to be uneven. And also human breed horses for performances, like doesn't matter what discipline, but it's not for the good teeth or strong teeth per se. So the dental health in horses is very important. And you cannot really use the wild scenario to just say, yeah, my horse never needs dental.
That makes sense. So now that we've established that we all should be having our domesticated horses' teeth looked at on a routine basis, like what does a routine dental appointment look like? Because I think it's easy to assume that when your dental professional comes out, they just open the mouth and look at the teeth and work on them, and that's it, they're done. But it's actually so much more than that. And, in the same way that our human dentists, I know when I go to the dentist, they're often feeling like my lymph nodes and poking my neck and I know all kinds of other stuff. They're not just looking at my teeth. So, and it's the same with equine dental professionals too, right? It's more than just looking at the teeth.
Yeah, for my appointments, I always work with a vet. And before the vet sedate the horse, I usually assess the animal's balance before sedation. I examine the head anatomy, like seeing if there's any asymmetry. Are there any atrophied muscles? Are there bumps on the bar, which is between the canines and the incisor? That smooth area is called a bar. And is there any bumps on the bottom of the mandible? And sometimes I will ask the owner to bring out like the bits or tack they use and see if there's any like injury or marks that they left on the mouth. And there are research trying to link like full body symmetry with dentition evenness in horses. But in humans, it is already published that different bites, such as underjet, overjet, can affect human posture and cause other issues. So that's why I look at the outside of the horse and palpate the horse. And I also use other senses, such as smelling, to detect if something abnormal is happening, such as bad periodontal pockets or feed packing have really bad smells. And then the vet will go ahead and sedate the horse and do a physical exam, things like that. And I will further look into the lips, tongue, the corner of the mouth, the soft tissue, and the coloration, things like that, or any recession of the gum. And then I will start checking the occlusion, which is how good the teeth come together. And the lateral excursion is how well they slide against each other. And I usually start with incisor balance. So there's a debate on whether incisors should be touched or not. But in my opinion, um, when you go to see a human doctor, they don't just left your four big teeth in the middle alone and just clean up other teeth.
Right.
They look at all of them. So
Right.
and yeah, and a lot of pathologies actually on incisor lately, such as the famous EOTRH. So it is important to look at the incisor, and when you balance it, this is probably too technical, but the angle of the incisor shouldn't be steeper than pointing to the temporomandibular joint, because that's going to cause more pressure on the meniscus, the disc in between the TMJ joint. And yeah, so it is important to get on your incisors and get it checked. And also check if your practitioner do like canines and remove the tartar, because those tartars will harbor bacteria underneath the teeth and cause like rotten or gingivitis pretty bad. So those are the areas I will first clean up and check. Then after that, I will use a speculum and, very importantly, a really bright dental headlamp to examine the cheek teeth. And I'll use like a probe to go through some pulps and flush out the diastema or the space in between the teeth. Make sure I got a good look and chart down my findings with an app that I use called Pinbury Dental App. And some other tips that I will always do is like counting the teeth. It's super basic, but sometimes they have supernumerary teeth or they are missing a teeth. There's a drift that looks like the arcade is pretty, but it's actually missing one, things like that. And then you can ask owner questions related to your findings, such as like, what is this horse on a certain feed? Because it's the staining is really bad, or there are a lot of caries in there, things like that. Or sometimes you can even predict what the rider preference is, because one side maybe have more bit wear than the other, things like that. And after that, talking to the owner, I will look for malocclusions, which is like wave complex, hooks and ramps, those protruding teeth and unbalanced teeth. And I will look for pathologies such as periodontal disease. It's inflammation around the periodontal ligament. Periodontal ligament is what holds the tooth together. So I will look for that and look for like hairline fracture, things like that. And some people might think I do teeth really slow because my observation and charting time is usually like 10 minutes. And even for my own research horses, I run endoscope. So it's like a 15-minute of mouth tour. So the actual dental like equilibration, the floating time, it's around 10 to 20 minutes. But always remember to close the mouth for breaks and water the mouth to keep it moist and free of dust. And another special thing I would like everybody to remember is do not feed your horse when they're sedated. It's very
Yeah.
prone to choking, and then or even they bite on themselves. It's just not great. So don't feed your horse within like 2 hours of sedation, things like that.
So
I'm
that's
sure
after,
veterinarians will
yeah.
give that.
So
Yeah.
after you're finished your work, that they don't eat for 2 hours afterwards. Yeah,
Yeah.
I think the time that you take, I think it's important though, because I mean, I'm like my daughter's pony. We bought him, and how old was he? 7 when we bought him. And so, and we don't need to get into this, but a lot of people will have the wolf teeth, the very first premolar teeth. They'll often have them removed, right, when the horse starts being worked, because sometimes it interferes with the bit interferes with the teeth, not the teeth interferes with the bit. The bit's what we're
Yes.
putting in the horse's mouth. The teeth belong there, but we take the teeth out sometimes, those wolf teeth. And he actually had, so at 7, he probably had those removed, I'd guess probably at least at 4 at the latest, and if not before then. And he actually had a little fistula where a little piece of wolf teeth had obviously cracked off and had been left behind and had been in there for probably 3+ years, and he'd had a dental every year, but nobody had noticed it. And it wasn't, it was really interesting that when he had a more thorough dental with somebody who actually whose specialty was dentistry, she noticed it right away, and we removed it. And I just thought, gosh, how uncomfortable must he have been having this little tiny bit of chipped tooth in his gum with the bit potentially, hitting that. And he'd had multiple dentals because he'd had a dental every year. So anyway, so just for that, I think sometimes if you go too quickly, you can miss things. So I don't think it's a bad thing if you take your time.
Yeah, I usually take my sweet time looking at the mouth. And there are other wolf teeth that's like blind, which is just covered by the gum and you feel a bump in there. And a lot of times you need radiograph to see if there's something
Mm-hmm.
down there and may have your vet take it out or something. But it's really easy to miss stuff in the mouth.
Mm-hmm. But I think your point of letting them bring their heads down frequently is really important. That if you're taking your time, the thing that goes with that is that because oftentimes when they're having dental work done, their head is being kept in an unnaturally high position, right? So that you could see in the mouth more easily, which is potentially stressful on some of the joints and things. So it is important. I know my equine dental professional lowers the head very frequently and also closes the speculum fairly often. So their mouth is not being held open unnaturally for really long periods of time while she's working. She'll close it, she'll go away, change her tool, come back, reopen the speculum, that kind of thing.
Yeah, those are all important steps because if you open it for too long, it's extra stress on the TMJ, and also the muscles. It just kind of gets like stretched for a
Mm-hmm.
long time, and you get sore after that. And some people might report feelings like horses is not as free of movement the day after the dental when they are riding, and that can be an issue if the speculum was open way too long, or if the horse like bite on the speculum really hard, things like that. So it is very important to have a good sedation from the vet and B, give them rest time.
I have two things to add to this. One, Claire, don't forget the part about the person that's holding the horse's head. Remember when you were like, why are you holding the pony's head?
I don't, yeah.
Because he's so tiny. So
Well,
my arms are jello.
So my equine dental professional has a setup where like nobody's ever holding heads, even the tiny ponies, like their heads, like she has this whole roping mechanism where they're in a, like a head cradle and they're suspended on the rope. So even when they're tiny, meanwhile, apparently Jill's doesn't. So Jill ends up holding the sedated horse's head, which is really heavy. And yes,
Anyway,
this is news to me.
Yes. And I'd like to see if your dentist is actually doing like 9 and 10 hand ponies because it's a really long rope to rig it up. She does have one. But anyway, don't forget to let your helper rest their arms. And the second thing I was going to say, when you were talking about checking the incisors, I have ponies that both wear grazing muzzles 24/7, and they also eat out of hay nets. And so the incisors need to be checked. I'm not going to get into the whole argument about wear on the teeth because I would rather have worn front teeth than have laminitis any day of the week. But those do need to be checked every single time. And if there are sharp points on the front, they do need to be taken care of at that time. And I think that that's something that you should make sure that you are checking, or your vet or your dental professional is checking those front teeth for that wear.
Yeah, absolutely true for both opinions. I have a setup with dental halters, so I don't need a helper to lift it. But definitely there are times when the mini is so low to the ground and I have to lay down and hold the
See?
little head and do it with my one hand instruments. That is pretty challenging. That's like a full gym workout. So yeah, definitely remember to let it rest. Otherwise your human's gonna be sore too.
For sure.
She gets me. She understands. What are some common issues that you might find while you're working in a horse's mouth?
There are a lot of different issues that you can see in the mouth, and I will start with the incisor. And for incisors, in my own research, that I did a little epidemiology type of study. In the incisor, you see a smile a lot, which is like the curvature of the incisor that makes it when a horse opens its mouth looks like a smile. And or ventral curvature or dorsal curvature, which is like a frown, like it's just the opposite of the ventral curvature. You can see that, but it's less common to see the dorsal one. But also you can see slanted jaw, like it's diagonal bite. One side is like severely taller than the other side, things like that. And also another common one is the corner hooks. And some people might argue that corner hooks are an aging factor, but in my research and some other older research in the past, they all found that it is not very accurate because horses at any age with its anatomy it's gonna happen, so it's not no longer a good indication for aging. And for canines, the most common one is definitely tartar covering it and cause gingivitis and really bad smell. Then for the cheek teeth, both the premolar and the molars, we see a lot of like periodontal disease, peripheral caries, and we also see like abnormal spaces between each teeth and cause like a diastema and a periodontal pocket. And then a lot of fees will like go in there and then cause like fermentation and bad smell. Then also malocclusions, which means like the teeth doesn't come together really well, and they usually have like hooks and ramps and super high teeth that's called protuberance, or and the opposing side will be like low, really small because one side is just so much more protruding. And I've even seen cases that like the lower teeth it's way too tall and like penetrate into the maxilla and the horse just blocked their mouth, basically.
Yeah, I actually had a horse when I purchased him that he had no lateral incursion. Like you would try to slide one jaw over the other and it would go clunk because he had this. But then he also had he had an ulcer in the side of his cheek, which is just basically like a sore right where the teeth had rubbed, and like the bottom he had a bottom tooth that was touching almost the roof of his mouth. And yeah, so I think that those you can see, even in horses that are quite well taken care of, you can see kind of sores and ulcers on the inside of their cheeks and things sometimes from the sharp points. So,
Mhm.
um, so he actually had quite a severe wave, and obviously he'd been lacking some dental care. And my dental specialist, did what she needed to do, but it was amusing at the time because she really wanted to keep going. It was not perfect, it wasn't a perfect job, and she wanted to keep going, and she sort of said, no, like I need to stop, and I'm going to have to come back in 6 months time to finish this, even though the mouth is not as even as I'd like it to be and what have you. I need to stop and come back in 6 months. So can you explain why you can't always do everything that actually needs to be done in one visit?
So yes, there are several limiting factors about equilibration or floating. The best indicator about how far you can burr down or how far you can correct this thing is the secondary dentin and the occlusion. So secondary dentin is a dental material that covers the pulp where the blood vessels and the nerves are. If the burring gets too low in the tube of the secondary dentin and the color goes from like brown to like light creamy color or even pink, that's a little bit too much and it might cause death of the pulp or open up the pulp. It's very painful, and that's basically a tunnel of bacteria can just fly into it.
Mm.
And for like the case Claire just mentioned that one side is like poked into the other side, you will like to see that after the dental adjustment, they are not really touching each other so they can relieve the pressure. So it's about occlusion, how well they come together. So that all limits like every single tooth, how much you can work on because of these two factors. And be kind of like aware that new occlusions, new new mouth arcades, they are basically means new biomechanics. Just like human, when you first wear braces or even have like different like elevated teeth, things like that, we change the way we chew, or sometimes even like in research, we change our posture or how we walk. So horses need time to adapt to eating and working as well. And also considering like TMJ, if you make too much of a drop or increase, the TMJ might also get impacted and change the full body biomechanics. So it is important to think about how horses can adapt and do a little by a little every time, considering multiple limiting factors.
Yeah, that's a really good thing to consider, I think, especially in our working horses, right? So it sounds like probably having dental work done like a few days before a show is probably not a great idea. not
No, it
not
is
very fair,
not.
not very fair to your horse. So as horses age and they have less and less tooth left to work on, there's a risk that the teeth can become loose, right? And these gaps that you mentioned can occur between the teeth, increasing the risk of periodontal disease. Like, can you speak a little bit on some other issues that are more specific to senior horses that you see?
Yeah, for the senior horses I've seen, if they don't have super well dental care in the past, they will have like diastema, which is abnormal space between teeth, and it's called senile diastema because the teeth angle changes over time, and when it's losing the amount of reserve crown, it might not be as well like planted in the mouth, and it will cause like drifting of the teeth. And if there's a loose teeth, the periodontal attachment is like almost non-existent. That will also be a phenomenon in some horse mouth that you can find multiple loose teeth in one mouth. But the key is not to extract them all because your horse will have to eat a soup if you do that, and it probably won't be comfortable and maybe potential inflaming if you pull multiple teeth out of an old horse. So sometimes it will tighten up by itself. You just have to make sure the pressure on that tooth is not too strong. And also another issue that I see a lot is feed packing because the food are harder to grind up, so you can see long stem pieces just stuck in here and there. And also, senior horses have expiring tooth, so the tooth surface will be just kind of yellow and have no structure that you see in a young horse, and that will make it really, really smooth, and you pretty much lose the surface grinder and you have less occlusion to work with.
Mm.
And some people might say EOTRH is also a big issue. And I agree, but I don't think it's a senior only disease now. It is
Oh,
getting
interesting.
younger.
Hmm.
Yeah. And its etiology is still unknown, but we are for sure is knowing is it's multifactorial. And the youngest it can get is like 10 years old. There are research coming out saying 10 years old are getting EOTRH signs.
Wow.
So
Wow.
yeah, it's getting younger and younger, and people are trying to figure out why and how to treat this. And also, there are some research regarding certain breeds, like Icelandic horses in Germany have high EOTRH rate, but they are in their research they try to see if it's the management practice or the breed itself, so that I think they do one in like Iceland, like with the original primitive area, and see the EOTRH, and I don't see much, but in Germany there's a bunch. However, they were not able to find correlation with like feeding practices or any husbandry, things like that. So the only factor they found might be a risk factor is the age. Everybody knows, and also male horses, but they have more male horses in the study, so that's why I think male
Right.
horses might have more UTRH. Um,
And
yeah.
we should, for our listeners who aren't familiar with this abbreviation, and this is a mouthful, no pun intended. So it stands for equine odontoclastic tooth resorption and hypercementosis. So it is a condition where horses, it's thought to be somewhat autoimmune, I think, or at least it was at one point. I don't know if it still is, but they're putting down like really high levels of cementum like onto their teeth. I mean, I've seen a horse that's had incisors removed that has this condition, and the roots of the teeth basically have all this like extra cement deposited on them because the horse is like resorbing the teeth, and then it's also at the same time trying to prevent that from happening is kind of my understanding. And so they end up with these like really big growths on their tooth roots, which end up being extremely painful. And so I mean, certainly the horse that I knew that had the condition diagnosed once, it was quite a severe stage, and they did have to have all their incisors removed. He had lost a significant amount of weight, and they had spent quite a lot of time working him up for this, that, and the other, and all kinds of different orthopedic conditions. And then eventually the equine dental specialist came out and identified this condition, and they took out his incisors. And you might think, oh my golly, he removed, like literally they took out all of his incisors over two time periods. And he continued to eat just fine, ate hay just fine, and regained all the weight that he'd lost. And I think he had been so painful, he hadn't wanted to eat because it was really painful to eat. And once those teeth were removed, he was no longer in pain and quite happily ate even long stem hay, since the incisors aren't involved in grinding, right? They're just involved in getting the hay in the mouth. It didn't matter that he didn't have the incisors; he could still eat long stem hay, and he regained all the weight that he lost. So yeah, he was a really interesting case.
Yeah, EOTRH is more and more common now, and some people is afraid of doing the surgery, but honestly, it is more helpful because EOTRH is really painful and sometimes even affect the bone, the jawbone. So the bone density will decrease and it was more prone to jaw fracture, things like that. So it is
Wow.
better to detect it early and get it out. But EOTRH can progress really fast or really slow. Every horse is different. So it's hard to say that. So I wouldn't say just put the horse on supplements and you don't have to worry about it. It's still something that you have to keep monitor and have your vet take x-ray and like recheck it every year.
And it's an
Yeah.
interesting, because they think that saying, the old sort of, oh, well, he's long in the tooth, is part of what happens, right? Is the gum recedes on the incisors, and so the teeth look like they're really long because of all the gum recession. And that's not just an old horse. There used to be, oh, it's just an old horse, he's long in the tooth, kind of inverted commas, but actually the long in the tooth is because the gum is resorbed because of this condition and not because of his age. And so that's just something for people to look out for. And the other thing that I had pointed out to me is that they sometimes get these like almost like little blisters in their gums, and that can be an early symptom as well. The teeth can look normal, but they have these almost like little blisters in their gums. So definitely something that, again, hopefully a well-trained professional will spot early. Certainly that veterinarian who identified it in the horse that I was talking about went through, she had 5 dentals that day, and they were all done, just so happened, in older horses. 3 of the 5 horses had the condition. He was the most severe and had to have his incisors removed, but 2 others were in the earlier stages of it, and they were in their kind of mid-late teens. And so it's like once you knew what you were looking for, we could find it in multiple horses. This isn't the same barn. So it's worth asking your vet specifically, especially if you have an older horse, or really any horse, I guess now over 10, I guess is what I'm hearing,
Yeah.
to really think about it.
I was going to say also, if you've never seen this condition, you should Google it and familiarize yourself, because I think once you've seen it a few times, like I see it pop up on Facebook quite often now, and somebody's like, what's wrong with my horse's teeth? And once you kind of learn what it is, you can spot it pretty quickly. So even if you don't have a senior or an older horse now, I think it's worth taking a look at it for future, or if you ever have one in your barn that there's any question about it. It's all, I mean, from science, it is also a little bit interesting. I mean, it's sort of gross, but it is interesting to look at and see all these different mouths and the calcification, like the buildup and the ulcers, like you said, like the blisters that come on it. Anyway, you should check that out.
Yeah. Jill loves gory stuff.
So I do. So I know that a lot of people think that they should get their horse's teeth done once a year. My horse gets his teeth done twice a year for 2 reasons. One, he's missing one of his eyes, so he already is a little bit lopsided in chewing and everything else that he does. And then he also has a weird tooth at the back of his mouth, the last tooth at the back on the top. And so he's on a 6-month schedule, so we can keep an eye on that. But do you recommend 6 months, 12 months, and what type of situations would people need a 6-month follow-up or a visit?
Yeah, so typically once a year is the minimum. A lot of people thought just 1 year is fine, but no, that's the minimum. So usually I recommend checking 2 to 3 times a year. And for those that need to be done for sure, 6 months interval or even shorter intervals are severe cases such as like sheared mouth, which like both teeth are like slanted and there's almost no occlusal surface. It's just too slanted, like mudslide of teeth coming together. So in those cases, definitely like even every 3 to 4 months, you have to recheck your condition again and see if you can work on it a little bit more. And also severe wave complex. Some horses, they will be good after the teeth is done for like 2 months, and the third month, fourth month, starting again to drop hay or drop stuff. So that those cases will have to be checked more frequently as well. And especially if you have a young horse that has a missing tooth, that one must be checked every 6 months because the tooth erupt with the pressure from the opposing tooth. That's kind of how much they erupt. But if there's no opposing tooth, there's no pressure to stop the teeth from erupting, so they will just go up and up and up, and then that's how you get a horse that has like protruding teeth into the other side of the maxilla or mandible.
That makes sense. Yeah,
Yeah.
and I think that it's I mean, I know that. So again, like my veterinarian who does my regular regular vet care also is a dental specialist. And so she's really good about, let's say I have actual dental work done in the spring. When she comes back in the fall to do fall vaccination, as part of her kind of health check, she takes a temperature, pulse, and respiration on the horse. She puts a weight tape on him. She body condition scores him. And she always opens his mouth and looks in his mouth and does a quick check of the teeth, even though he's technically not due for a dental for another 6 months. Like she always has a quick look in there just to make sure that everything is in fact on track for a 12-month dental. The last time I had one of them done, he was starting to develop a bit of a wedge. And that was back last spring. And she said, well, we'll look at him in the fall and we'll see what's going on, because she said this can be an indicator of a couple of things, but I'll correct it now and then we'll look at it again in the fall, and if it's come back, then we'll have to have a conversation kind of thing. And she looked at him, actually she happened to be in the barn about 3 weeks ago and looked in there, and it is starting to come back, so we're trying to kind of make a plan now of what might be going on with him. But so I think it is important. I think when you have really good thorough veterinary care or dental care, they're looking in there like every 6 months or whatever, even if they're not doing actual active dentistry.
Yeah, the mouth problems actually come back a lot sooner than people think. There's a condition called excessive transfer ridges, which means like the little mountains you can see on the occlusal surface gets too severe and literally looks like crocodile teeth, and then they cannot grind properly. They'll get locked. Those ETRs, they come back in like 90 days. It's from a really recent Brazilian research that they come back in 90 days after
Wow.
you. Yeah, so it is just 3 months they can come back. So if it's a young horse, then you probably have to check in multiple times a year. And the most intense program I've ever heard, it's not my client, they check the mouth like 4 times a year. So every three months they just check it because it's young baby barn, and they have cap shedding all the time, and they have really like soft enamel points that will keep coming out, things like that. So they do it every 3 to 4 months.
And I think
Yeah.
that's a really interesting point, because I think I definitely hear people sort of saying, well, no, my young horse hasn't been seen by a dentist yet. He won't get seen by the dentist until we're ready to ride him. And then the dentist will come out and take the wolf teeth out, and then we'll start him and put him under saddle. And yet, like to your point earlier, there's so much going on in those first 2 or 3 years that you can really get ahead of some problems if you at least have a dental professional look in the mouth, even if they don't do anything. Right? You can find the undershot and overshot jaws and those sorts of things that might need action taken sooner rather than later, just to prevent something from happening that would be an issue for the horse's entire life.
Yeah, so definitely get your horse checked way before you are about to ride the horse, because there are several things that can happen in horse mouth, like younger horse mouth, such as the baby teeth shed, but there's no adult teeth coming in, and that might be a genetic issue. So, how are you gonna manage this horse's deviated teeth? Like, how are you gonna make sure that it doesn't lock up and it's like eating fine, things like that. So, there are some cases like odontoma as well. That's like dental tumor, basically. They grow underneath the underneath the jaw sometimes. So people will have to be careful about like seeing these kind of difficult cases. And I even seen a young horse probably got kicked in the face and have curved teeth, looks like those pig teeth that's curved, and then and sometimes there is one that looks like mustache, like curved outwards. So there are all kinds of odd cases that can happen in young horses, especially they are more prone to like heavy fighting or like playing rough, things like that, or rub on stuff, bite on random things. So it is important to have the young horse's teeth checked.
That makes sense. And there's so much more to talk about. And Kai, let's have you back. It's been a pleasure to have you on today. And we will get back together and we will talk all about the effect of sort of dentistry and dentition actually on like nutrition and digestion, because that in itself is a really important and interesting conversation. So we will have you back and we'll do that in the future. Thanks so much for joining us today.
Thank you.
For our listeners, if you'd like to be a part of our conversation, please send your suggestions for future topics and equine nutrition questions to info@scoopandscale.com and is spelled out. You can also find Claire at clarityequine.com.
We know that if you're like us, you're probably listening to this while driving or doing barn chores. But when your hands are free, if you'd share it with your friends on social media and be sure to subscribe on your favorite podcast platform, it helps other horse lovers like you to find us.
For the Scoop and Scale podcast, I'm Jill Jackson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.